In tonight's pre-election segment, we turn our attention to question 1. This would set new requirements on the ratio of patients to nurses in hospitals and other facilities providing health care. Calling for a yes vote is our guest from the Massachusetts Nurses Association. We'd like to welcome one of the nurses speaking for the campaign, the association's vice president, Karen Coughlin. Thank you very much for being with us, Karen.
Thank you for having me.
First, I want to ask you about, first of all, if this were to pass, what would it do to those ratios?
So what it would do, it would set a safe limit to the number of patients assigned to a nurse in a hospital setting. Right now, there are no limits except in the intensive care units in our hospitals that require how many patients can be assigned to a nurse. And we are finding that patients are much, much sicker than they ever used to be. And nurses, unfortunately, are being assigned too many patients at one time, and they do not have the time and the ability to care for the patients in the manner in which they were trained to do. And when you have too many patients on your workload, bad things can happen, and there are poor outcomes for our patients. So question 1 would set a limit on the number of patients assigned to a nurse in a hospital setting. And it would vary depending on the type of unit that the patient would be on and the acuity or severity of that patient's illness. So there is flexibility that is built into the initiative so that you could potentially spend more time with your patient if the needs of that patient required it, but you could not go over a specific limit. Right now, nurses don't have any say at the bedside as to how many patients they are assigned, and this actually empowers the nurse and provides flexibility to the hospitals to be able to flex down if a patient's status and, requires it.
Well, you're with the union. I know you have some leverage to deal with this through collective bargaining, but just drawing from your own experience, have you ever seen a situation when there wasn't enough attention to spare because a nurse was tied up with other things? And did that really matter that much?
It does matter. It matters a lot. I would say that if you're in a hospital right now, you are very sick and you require 24-hour monitoring and care. And if your nurse is tending to the needs of other patients and cannot get to you, there are things that can be missed. And what we are seeing is that it increases the risk of, and we're hearing from nurses across the state related to this, there's a risk for medical errors, medical complications, falls, specific things that you want to spend time and attention to, providing education to your patient about their condition, about their discharge planning, what needs to be in place, what they need to be aware of, etc. And if you don't have the time and attention to do that, then the safety of the patient at the bedside increases the risk for poor outcomes and the health of that patient.
We can all imagine hospitals trying to be tight with the budget while all this is going on. And I imagine that it also has consequences for hours for nurses. What could you say about that?
Well, I'm not really sure what you mean by hours for nurses.
In other words,
I do
when
know
they have to work, if they have to work overtime more often because there's an attempt to save money going on as well?
Well, what we have found in the hospitals, by the way, in Massachusetts hospitals, it's a $28 billion industry in revenues per year. And over the last 5 years, they made $7.1 billion in profits. So this is an industry that can very well afford to take care of the patients that are at the bedside. What they're doing, though, is they're making choices purely related to profitability and their profit margins related to patients and the services that they provide. And the bottom line for the nurses isn't the profit margin, it's patient safety and the patient at the bedside. So, some of the things that we're seeing, this would set a standard of care and would hold hospitals accountable to provide the level of care that every patient should deserve. It shouldn't matter where you live in the state or what your socioeconomic status is. You should be able to receive the same level of care no matter where you go to receive that care.
You've probably by now heard the report on this from the State Commission. I know it's somewhat controversial because of the figures they're using, but their conclusion was this is going to cost almost $1 billion extra a year, and in the aggregate at least, there isn't going to be much improvement in patient outcomes. What do you say to that?
Well, what I would say is that there are mountains and years of research that show there are better patient outcomes when nurses are assigned, less patients in order to be able to provide that care to the patient. So there's over 30 years of research. So that to me is one of the things that they're putting out there that is a falsehood, that there is no research to back that. As far as the figures go from the Health Policy Commission, I would say, there is some disagreement among the parties related to the cost, and we believe it's much, much lower. We also believe it really wasn't a transparent process with the Health Policy Commission. Unfortunately, we were not aware, they had denied it, but they had been meeting with the Mass Hospital Association, who is the sole backer of no on question one, the hospital industry. And they had been meeting with them for several months, and they utilized the data that was only provided to them from the Hospital Association, who are the proponents of no on question one. And so we weren't even invited to the table to ask for independent research and data specifically. So that being said, I always say it really isn't about the money. When you strip everything else away, these hospitals can afford it. But when you strip everything else away, what it is about the safety of the patient at the bedside and what do they need and what should we be able to give them. That's what this question is about. This is about when I always like to say, my mom is 82. She lives in the southeast area of the state. She has dementia, and I fear for her because I know when she goes into a hospital, I want her to be one of 4 patients assigned to that nurse as opposed to one of 6, 7, or 8. And I want somebody in the hospital industry to look at me and tell me why she wouldn't deserve that, because she does. And I think every patient in every unit and every hospital deserves the same thing.
You mentioned there are other studies out there. Is there something you could point to, maybe research showing that a higher ratio of nurses might result in fewer return trips to the hospital?
Yeah, so that is one of the things. So when we talk about return trips to the hospital, a lot of times patients, they leave the hospital, they think they are well on the road to recovery, and then they find themselves readmitted in less than 30 days upon their discharge. And a lot of times what they find out is that they are being readmitted for conditions that could have been prevented when they were in the hospital. And we have data that shows out of all the acute care hospitals throughout the country, Massachusetts ranks 6th worst for readmission rates to hospitals. It is appalling that we rank that well, that not that well, but that poorly. And this staffing ratios have been in effect in California for well over 14 years, and they actually are number 10 of the best readmission rates. So they have very few readmission rates compared to Massachusetts hospitals. And hospitals get penalized oftentimes for readmission rates under 30 days for conditions that could have been prevented when a patient was in the hospital.